Mesdames, Messieurs,
Ladies and gentlemen, hello. On behalf of the Pierre Fabre Foundation and its president, Pierre Fabre, I'm very happy to welcome you to Ondos, the head office of the foundation, for the inauguration of the Observatory of the e-health and the first edition of this meeting. So we're with you not only here in this amphitheater, but also all the audience that is in fact present on the 15 campuses. So on live, they are also getting the transmission, the broadcasting via internet streaming. So one of the cameras, I say hello to everyone. So we're very proud to have this partnership. The Dean, Jean-Paul de Godfrain, is going to talk very soon from Paris. Unfortunately, he couldn't be with us today, so he has to speak from Paris. I'm also very happy to inform you that the French Agency of Development, Mr. Observatory, has decided last Friday, to also support the observatory. So the usefulness of the e-santé, e-health foundation came as a natural, I would say, approach, because we have to test the new technologies in particular the mobile phones, and also what are the opportunities of these developments, including also in different sectors, in environments where resources are very limited and restricted, so innovation is paramount there. A couple of examples. I see what's going on in Kinshasa on the initiative of the professor of Montpellier. And also they've developed a screening program for sickle cell disease. And one of the problems that we have is the loss to follow-up patients, because we no longer see what's going on with them. So we've seen that we've had a very significant drop of these lost to follow-up patients. So now we could have a telephone number, a mobile phone, maybe not them directly, but a relative. And so now the programs are much more effective thanks to these mobile phones. Now Madagascar is another example. Dr. Erizou, who's a young engineer doctor, developed a prototype of an app. This app is in fact the health book of some, in fact, patients. Now, third program, teledermatology in Bamako, directed by Professor Guzman, who's in the room with us. And so we're very happy to have them. So this program is going to now give access to the 10 derms that are in fact based in Bamako, so opening up their skills to the entire population, not only close to the capital, city, but also in urban areas, in rural areas. So the e-health meeting, Virginie Adoa is the director of this e-health meeting, and in fact we followed them. We have given took us some inspiration, so that is why we've decided to have partners. So without their support, without their hard work, this conference today wouldn't have been possible. Now, the key question is maybe to say how the Pierre Fabre Foundation could better understand and also contribute to the development of these new technologies promoting health. So the idea came from several observations, several facts. Lack of data, especially the rendered medical services. That's the first, I would say, observation. Now, second fact is that we have several pilot studies that don't necessarily see the light. So we think that there's a real mission from the observatory to be able to encourage, to also document, and also detect potential projects. And 1 year after, the observatory is now online via website. It is the odes.io, and so there on the website You will have 50 or so projects. We're very proud today because we will be able to show you a little what these projects are. We've also selected 9 applicants, 9 awards, and so we will see the various prizes for that. This networking with 15 countries, as you can imagine, we've got to respect the program of today. So that is why we have a kind of moderator, Lionel Dionic, who is not only going to be chairing the meeting, but also moderating and animating the meeting. Now, before handing him the floor, I'd like to first hand it over to Jacques Godfrain, who's the administrator and treasury of the foundation. Dear Chair, ladies and gentlemen, dear Béatrice, the Pierre Fabre Foundation is a foundation which has been approved as being beneficial to the public. And therefore, the objective is to give better access to medication, of course, higher quality medication in underdeveloping and also emerging countries. Now, the foundation was created in 1999 by Mr. Pierre Fabre, and as you know, he had not only a vision, he was also a pathbreaker, a wonderful way of looking at the future. And so today, this foundation is the core, the heart of basically the succession, the organization also of the succession of the company. And this means what? It means that Pierre Fabre as a company, the foundation also, there's a very close link. And so this ensures sustainability. Now, in addition to what I've just said, there's always been a big concern of working with southern countries, not only as a north versus north, but also a south, also going north. And this is something that also we've been talking with lots of experts. So the idea is to set up this kind of expert network. We believe that southern countries can bring a lot to northern country. And I'd like to thank Béatrice because today, this meeting today is a perfect token of what Mr. Pierre Fabre wanted, innovation serving health. So a day that is dedicated to all these initiatives. These initiatives come from northern countries, but also local players in southern countries. We want to reward this energy. Lots of young people have really worked on e-health. It's a new discipline in a way. And we're very proud to have this meeting in the town near Castres, and we know that there's a big concern and big work lots around e-health. So better access to medication, caregiving, expert and skilled caregivers. Why? Because the right to health is closely part of the human's right. So 9 candidates have been selected for this first edition. And last evening I was very happy because I was able to discuss with a lot of these candidates. And I describe them as pioneers. Pioneers not only in their country but also on the international map. Cameroon, Senegal, Ivory Coast, Morocco, and the Philippines, to name a few. And they will testify that their project, their educational project also, is here not only to express the success, but also to see some difficulties to really highlight all these potentials of these new technologies. So this conference, as Béatrice has said, is seen globally, worldwide. So I'd like to welcome everyone around the planet, but it's also the wish of the foundation to talk in fact, to everyone, not just in France, but also promoting dialogue, exchanging knowledge, culture between North and South country. The idea is to broadcast and disseminate this information. So medically speaking, technically speaking, we of course foster all these partnerships. We want to act as drivers for these projects. Thank you.